The sudden, sharp agony, understanding and banishing leg cramps. That sudden, searing pain that grips your calf, foot, or thigh, often striking in the dead of night or after exertion, that's a leg cramp. These involuntary and often excruciating muscle contractions can range from a fleeting annoyance to a debilitating episode lasting several minutes. 1 While usually harmless, frequent or severe leg cramps can significantly impact your quality of life, disrupting sleep and hindering daily activities. 2 Understanding the myriad causes behind these muscle spasms and knowing effective strategies to alleviate and prevent them is key to reclaiming comfort and control over your legs. Unraveling the mystery. What causes leg cramps? The exact cause of leg cramps often remains elusive, classified as idiopathic in many cases. 3 However, a multitude of factors can contribute to their occurrence, making it essential to consider various possibilities. 1. Physiological factors. Muscle fatigue and overexertion. Pushing your muscles too hard, especially without proper warm-up or cool-down, can lead to fatigue and an increased susceptibility to cramping, particularly during or after exercise. 4. Dehydration and electrolyte imbalance. Muscles rely on a delicate balance of fluids and electrolytes, minerals like potassium, sodium, calcium, and magnesium, for proper function. 5 Dehydration or an imbalance in these electrolytes can disrupt nerve signals and trigger muscle spasms. Excessive sweating during intense exercise, especially in hot weather, can exacerbate this. Prolonged sitting or standing. Maintaining the same posture for extended periods can restrict blood flow and lead to muscle fatigue, increasing the likelihood of cramps. 6 Sitting with legs crossed or toes pointed downwards can shorten calf muscles, making them more prone to spasms. 7.
Age. As we age, our tendons, the tissues connecting muscles to bones, naturally shorten, making muscles more susceptible to cramping. 8.
Pregnancy. The added weight and circulatory changes during pregnancy, particularly in the later trimesters, can put extra strain on leg muscles, increasing the risk of cramps. 9 Pressure from the growing uterus on nerves in the legs can also contribute. 2. Medical conditions. In some instances, leg cramps can be a symptom of an underlying medical condition. Neurological disorders. Conditions like peripheral neuropathy, motor neuron disease, and multiple sclerosis can cause abnormal nerve activity, leading to muscle spasms and cramps. 10. Circulatory issues. Poor blood circulation in the legs, often due to peripheral artery disease (PAD), can deprive muscles of necessary oxygen, leading to pain, spasms, and cramps, especially during exercise. 11.
Metabolic disorders. Conditions like diabetes, especially with nerve damage, kidney failure, liver disease, leading to toxin buildup, and thyroid problems can disrupt electrolyte balance and nerve function, increasing the risk of leg cramps.
Structural issues. Flat feet or spinal stenosis, narrowing of the spinal canal, can sometimes contribute to leg cramps. 12.
3. Medications. Certain medications can have leg cramps as a side effect. Diuretics. These medications, often used for high blood pressure, can deplete electrolytes like potassium and magnesium. 13. Statins. Cholesterol-lowering drugs have been linked to muscle pain and cramps in some individuals. 14.
Certain medications for asthma, Alzheimer's, and osteoporosis. Some medications used to treat these conditions can also list leg cramps as a potential side effect.
4. Other factors. Abnormal nerve activity during sleep. This is a leading theory for nocturnal leg cramps, where nerves may misfire while the body is at rest. 15. Sleeping position. Sleeping with feet pointed downwards can shorten calf muscles, potentially triggering cramps. 16.
Nutrient deficiencies. While not always a direct cause, deficiencies in certain vitamins, like B vitamins and vitamin D, and minerals, like potassium, magnesium, and calcium, may play a role in muscle function and could contribute to cramps in some individuals. 17. Excessive alcohol consumption. Alcohol abuse can damage nerves, alcoholic neuropathy, and disrupt electrolyte balance, increasing the risk of leg cramps. 18.
The immediate relief. How to get rid of a leg cramp in progress.
When a leg cramp strikes, the immediate goal is to break the muscle contraction and alleviate the intense pain. 19. Here are some effective strategies. Stretch the affected muscle. This is often the most effective first-line treatment.
Calf cramp. Straighten your leg and flex your foot upwards towards your shin, either by pulling your toes towards you with your hand or using a towel wrapped around your toes. 20. You can also try standing and putting weight on the cramped leg, gently bending your knee.
Hamstring cramp. Straighten your leg and lean forward, trying to touch your toes.
Quadriceps cramp. Stand up and hold onto a chair for balance. 21. Bend the knee of the affected leg and pull your heel towards your buttock. Massage the muscle. Gently but firmly massage the cramped muscle to help it relax. 22. Kneading and applying pressure can help to release the tension. 23.
Apply heat or cold. Heat. A warm bath, shower, heating pad, or a warm towel can help to soothe tight muscles. 24. Cold. After the initial pain subsides, applying an ice pack wrapped in a towel for 15 to 20 minutes can help reduce soreness and inflammation. Stand up and put weight on the leg. For calf cramps, simply getting out of bed and standing with your full weight on the cramped leg can sometimes help to stretch the muscle and relieve the spasm. 25. Walk on your heels. This can activate the muscles opposite your calf, encouraging the cramped muscle to relax. 26. Drink pickle juice. Some anecdotal evidence and limited research suggest that the high sodium content in pickle juice might help to relieve muscle cramps quickly by triggering a neurological reflex. 27. Over-the-counter pain relief. After the cramp subsides, over-the-counter pain relievers like ibuprofen or acetaminophen can help to ease any lingering muscle soreness. 28. Long-term solutions. Preventing leg cramps from recurring. Preventing leg cramps involves addressing potential underlying causes and adopting healthy habits. 29. Stay hydrated. Drink plenty of fluids throughout the day, especially before, during, and after exercise. 30. Adjust fluid intake based on activity level, weather, and individual needs. Stretch regularly. Incorporate regular stretching exercises into your routine, focusing on the muscles in your legs, particularly your calves and hamstrings. 31. Stretch before and after exercise, and consider stretching before bedtime, especially if you experience nocturnal cramps. 32. Ensure adequate electrolyte intake. Maintain a balanced diet rich in potassium, bananas, sweet potatoes, beans, magnesium, leafy green vegetables, nuts, seeds, and calcium, dairy, fortified foods. If you engage in intense exercise or sweat heavily, consider electrolyte-rich sports drinks. 33. However, consult your doctor before taking electrolyte supplements. Maintain a healthy weight. Excess weight can put added strain on your leg muscles. Wear comfortable and supportive shoes. Proper footwear can help support the muscles and nerves in your feet and legs. 34. Avoid prolonged sitting or standing. If your job requires prolonged periods of sitting or standing, take regular breaks to 35. Move around and stretch your legs. Adjust sleeping position. Avoid sleeping in positions where your feet are pointed downwards. 36. Try sleeping on your back with a pillow under your knees or keeping bedding loose at the foot of the bed.
Warm up and cool down properly. Always prepare your muscles for activity with a proper warm-up and allow them to recover with a gentle cool down.
Review medications. If you suspect your medications might be contributing to leg cramps, discuss potential alternatives with your doctor. Never stop taking prescribed medication without medical advice. Address underlying medical conditions. If your leg cramps are frequent or severe, consult your doctor to rule out any underlying medical conditions that may require treatment.
Consider vitamin and mineral supplements, with medical advice. If your doctor suspects a specific vitamin or mineral deficiency, they may recommend supplementation. However, avoid self-treating with high doses of supplements. Gentle exercise before bed. Light activity like riding a stationary bike for a few minutes before sleep might help loosen leg muscles. When to seek medical advice. While most leg cramps are benign and resolve on their own, it's important to consult a doctor if you experience any of the following. Frequent or severe leg cramps that disrupt your sleep or daily activities. 37. Leg cramps that last longer than 10 minutes and don't improve with stretching.
Leg cramps accompanied by swelling, redness, or skin changes in your legs.
Muscle weakness associated with leg cramps. Leg cramps that develop after exposure to potential toxins. 38. If you suspect your medication is causing the cramps. If home remedies are not providing relief, your doctor can help identify any underlying causes and recommend appropriate treatment options, which may include further testing or, in rare cases, medication like quinine, used cautiously due to potential side effects, or muscle relaxants. 39.
Leg cramps, while often a minor inconvenience, can be a significant source of discomfort. 40. By understanding the potential causes and implementing effective strategies for relief and prevention, you can minimize their occurrence and reclaim pain-free movement in your legs, leading to better sleep and an improved quality of life. Listen to your body, stay proactive with healthy habits, and don't hesitate to seek medical advice when needed.